Good morning, everyone. Welcome to our Medicare 101 presentation. My name is Sarah Wallace. I am there on the left. We're here today with Karen Anderson.
Hello, everybody. I'm over here in Buffalo.
And we work for AAA. So AAA is here to help you solve the Medicare puzzle because it's very complicated. Everyone has kind of a different path, but what we aim to do today is make sure you understand what the pieces are and when it's relevant for you. So as I said, Karen and I work for AAA. We're called what is an independent broker, meaning I don't work for an individual carrier. I work for AAA. So when we're going through and looking at people's Medicare options, we're looking at the best option for you across the board, across the carriers. Our territory is from Buffalo to Syracuse, Watertown to Ithaca, so anyone in there will be able to help out with any of your Medicare needs. Let's go through and talk about some common Medicare problems. So these are where people usually get a little bit stuck and where we're hoping this training will help you guys get, not get stuck. So enrollment periods, when to sign up for what, Part B penalties and how to avoid them. Physicians network. So we want to make sure any plan that you're looking at actually has your doctor in network and not, so you're not on the hook for that bill. We'll talk about prescription drugs and formularies and what all of that means. And we'll end talking about Medicare Advantage and a supplement plan and, what's the difference and what's appealing about the individual option. So the first thing we'll go through is enrollment periods, and this is important to avoid any penalties. So we'll go over the different pieces later in our conversation, but Part B as in boy and Part D as in dog both come with late penalties if you don't sign up at the right time or if you do not have creditable coverage. So let's talk about those timelines. If you are turning 65, you're going to be in that very top. It's the initial enrollment period. This is why you're getting bombarded by all of the mail. If you get mail from Social Security, make sure you open it. That's an important piece. Don't ignore anything from them. But this is where you're initially eligible for Medicare. It starts 3 months before your 65th birthday. So it's 3 months before, the month of, and 3 months after your 65th birthday. So this whole 7th month period is considered your initial enrollment.
So
Now,
Sarah, if I could just interject here, like I'll be turning 65 in August. So May, June, July. So this would be the 3 months beginning point then for people who have a birth date in August then.
Right.
Just
Yep.
for example.
Yes, just for example. Yep. Now, if you're turning 65 and you're not retiring yet, we will talk about that in just a few minutes, but you'll have what's called a special enrollment period. However, if you are planning on taking Medicare at 65, you're going to use your initial enrollment period. The annual enrollment period happens once a year, and this is where anyone in Medicare can make a change. So this is from October 15th through December 7th, and you can add, change, or drop coverage. You can go back to original Medicare if you'd want to. I'm not sure why you would, but there are reasons. You can change different Advantage plans, so you really have the most opportunity to make choices about your health during the annual enrollment period. And if you work with Karen and I, you actually get put on our annual enrollment period list. We give you a call and we say, hey, how's your health? Has anything changed? Here's what may change with your plan moving into the next year. Here's what didn't change. Does this still work for you? So this is really where you want to work with someone to understand your options year over year, because the plan you chose last year might be, perfect for last year's health needs, but something might change in 2022. Things progress as we get older. So it's important to check out and make sure every annual enrollment period that you have the right coverage for the upcoming year. The next enrollment period we'll discuss is the OEP, the Open Enrollment Period. And if you see here on the screen, it actually has an MAOEP. And this is for those people who are in Medicare Advantage plan who have decided that it's actually not the right choice for them. So this isn't advertised. You won't hear about this very often, but if you are in a Medicare Advantage plan, you can change your plan once between January 1st and March 31st to a plan that better suits your needs. So that's the open enrollment period, if you ever hear about that. Last category of enrollment periods, and there are a couple rolled in here, are those special enrollment periods. And these are triggered by specific events such as retirement or moving out of your plan area. So these happen more than once in your lifetime, and there's some that also aren't advertised. So it's helpful to work with Karen and I to make sure if you want to choose your plan, maybe there is a different special enrollment period that we can help you find. So Extra Help and state pharmaceutical assistance programs all have a special enrollment period attached to them. So that's when you do what, right? And if you hear these terms, we want you to be able to understand, what we're talking about or what others are talking about when it comes to enrollment periods. So now we know the timeline. Let's talk about the actual pieces, or the alphabet soup, as some of my clients call it. We're going to start at the beginning of the alphabet. That's Part A and Part B. These two pieces together are considered original Medicare, and the cards look right there on the right for you. So if you sign up for Part A and Part B, this will be through Social Security. So that's the office that handles those two pieces. And if you have signed up for both, they both will show up on your card. So that'll be important. So Part A, I want you to think of as just your hospital bill, basically a hotel bill, room and board. Part B is your medical insurance, and it's only 80% of your medical insurance. Let's go a little bit deeper into Part A and B. Give me just 1 second, I'm gonna take a drink. Now, Part A for most of the community is an entitlement. If you've paid into the Medicare tax for 10 years or 40 quarters, this will come to you with no monthly charge. Part B, the medical insurance piece of it, does have a monthly premium. In 2021, the monthly premium is $148.50 for most. Some of you may have what's called an IRMA, and Social Security will give you more information, but for most, the monthly premium is $148.50. And again, this premium is only for 80% of your medical coverage. It leaves you responsible for 20% of those medical costs. So 20% of a doctor's appointment might not be earth-shattering, right? But 20% of a hospitalization is, 20% of, expensive diagnostic tests are. So we'll talk about how you can cover that 20% coinsurance that original Medicare leaves open.
And, Sarah, I was thinking just this morning, just 20% of an ambulance ride to get to the hospital, even that is just can be out of sight.
Yes, absolutely. Yep. So it's not the little things you want to think of here. It's the what ifs. What if we do have that, that ambulance ride? What if I do need a hospitalization? What if I break a leg? It's not always life or death. Sometimes it's just a very expensive health event. So you want to make sure you mitigate that 20% risk. So before we go into that, I want to just talk about a couple other pieces of the alphabet. It'll be important as we move forward. So we know Part A is our hospital insurance, basically that hotel bill for the hospital. Part B is 80% of our medical insurance. Part D, as in dog, is a government mandated level of prescription drug coverage that everyone over the age of 65 is expected to maintain. And if you're working past 65, usually your company's group health insurance does have a piece that is considered creditable for this Part D coverage. So anytime someone says Part D, it's prescription drug coverage. And you don't sign up for it through Social Security. Part D plans are usually handled by private carriers. Same thing with the Medicare Part C there on the right. Medicare Part C are plans handled by private carriers that help mitigate the 20% risk. So we bring that up so you know that Part C isn't handled by Social Security. Part A and B are handled by Social Security. Part D is that mandated minimum level of prescription drug coverage. And Part C is a type of plan, Medicare Advantage plans that help mitigate risk. So going forward, I'm going to hand the mic over to our Karen to talk about how to cover the coinsurance.
Okay, thanks, Sarah, for that. All right, everyone. So here's the part of the webinar where we start explaining to you how we can help you lower your healthcare costs and avoid any late enrollment penalties, particularly with Part D. Keep in mind, with original Medicare Part B, there's an enrollment penalty if we don't sign up, if we don't enroll in time. However, once you get to that point and it's time to choose a prescription drug plan, you need to enroll within a certain time frame, or there will be penalties for late enrollment into your drug plan, the Part D of Medicare. And these penalties, they may not be too bad initially, but when you consider that these penalties follow you each month for the rest of your life, that can kind of turn into a chunk of change. So that's why we're here too, is to not just help you lower your healthcare costs, but also avoid any of those pesky enrollment penalties. So when it comes to lowering your health costs, original Medicare Parts A and B, your Part B coinsurance is 20%. So whatever healthcare expenses you have with original Medicare, you're liable or responsible for 20% of that expense. So what can we do to lower it? You've got two choices, just two. So you can go to what's called a Medicare supplement or a Medigap plan. And the reason it's called Medigap is because Medigap fills that 20% gap for you. And with a Medicare supplement plan, you'll also need to have a separate a Part D prescription drug plan. Or another option that you can look into is what's known as the Part C of the alphabet soup Sarah was referring to. That is a Medicare Advantage plan. And the Medicare Advantage plans bundle everything together. Your Parts A, B, and D, your prescription drug plan, those are all available to you in a Medicare Advantage plan Part C. So why don't we go a little bit deeper and go on to the next screen, and we'll take a look at the Medicare Supplement Plan or the Medigap. It's really up to the individual in a lot of cases what they choose. So let's take a look. There are good. There's good sides and maybe some sides that you might want to consider as you go through your healthcare, and that's why Sarah and I can help you to make the best decisions. So with a Medicare supplement plan, some of the nice things about Medicare supplement or Medigap plans is, number one, it's a very flexible plan. You can take it with you everywhere throughout the United States. It's flexible because there are no networks. So as long as you're seeing a provider, a physician, for instance, or you're going to a facility and they accept Medicare, you're all set. And generally, you can rely on your Medicare supplement plan paying for the 20% coinsurance that you have. Another thing that's nice about the Medicare supplement plan is that it's what has guaranteed renewability, meaning as long as you're paying those premiums, that plan will continue for you. You could stay in a Medigap plan for the rest of your life if that's something that you'd like to do. You know exactly what services are available, and the plans are very comprehensive so that you know upfront what to expect. and it's really what you'd call like a pay up front kind of plan. These plans do not, however, have coverage for prescription drugs. You would need to have a separate prescription drug plan, and Sarah and I can help you with that too. So for those who are real free spirits and they just want to travel all over the United States, and I worked with a woman just a couple days ago who is a tour guide, and she travels all over the United States, and the Medigap plan for her is wonderful because she never knows for sure where she's going to be at any particular time. So that's great for flexibility, and also for those individuals who may have very high medical bills with chronic illnesses, this is a good plan option for you. So let's go over and take a look now at the Medicare Advantage side. So with the Medicare Advantage side, this is more of a pay-as-you-go type of a plan, and where you're basically covered with your 20% on the Medigap side of things. You can expect to pay a little bit more as you go, depending on the care that you need, in regards to deductibles, co-pays, and coinsurance. And there are networks, meaning, for instance, in the Western New York area, there are some carriers where a network is the 7 or 8 counties of Western New York. And you would stay within that network for your services as far as hospitalization or going to see your doctor or anything else that you require as far as your health care is concerned. Remember that these type of plans bundle everything together, so it does include your prescription drug plan. And the other things that a nice advantage of a Medicare Advantage plan is there are extra bells and whistles provided in these plans that you won't find in a Medigap or a Medicare supplement plan. You'll have things like preventative dental. You'll have vision allowances and hearing, as well as gym memberships. You'll have what's known as a gym card. Any place that accepts these cards, and there are thousands of places throughout the United States, these gym locations. And you show your card and you can just go in and participate in whatever is going on at that particular gym. And what's become popular the past couple of years is over-the-counter allowances as well. And so if you need anything in the way of first aid or over-the-counter medications, this is also provided under some of these plans as well. So it's really up to you to decide. And if we take a look at the next screen, you can compare your options. So it really is up to the individual in most cases. Some people feel very comfortable about paying as they go. They feel very healthy. They don't have much in the way of prescription medications. And in that regard, a Medicare Advantage plan could be great. And then there are other people who feel, nope, I want to know up front. I'll pay up front and I'll be settled for the rest of the year. And anywhere I go, I know that as long as they accept Medicare, that I'll be covered for that 20% Part B coinsurance. So let's take a little bit of time. I'll leave just a few seconds and you can take a look and just read some of the differences there. I think the main thing to remember is you would need an extra plan on the Medicare supplement side, all right? The one thing that will make or break you with a Medicare plan is the prescription drug, Part D, prescription drug coverage. So let's take a look at that, Sarah, if you could move ahead. And when it comes to prescriptions, everyone, that's the one thing that I can counsel you on that is a big thing to consider when you're considering a prescription drug plan, either on the Medigap side with a separate plan or a Medicare Advantage plan. And it revolves around the type of medications that you're currently taking. So as you probably already know, there are 5 prescription drug tiers. And the closer you can stay to the generic drugs, the tiers 1 and 2, those are the least expensive drugs that you'll have to pay for, and I'm sure you already know that. But one thing that I didn't know was the preferred brands are tier 3, and depending on the insurance carrier. I thought when I first got into Medicare that the drug tiers were the drug tiers and they're the same throughout the nation. No, there's a little bit of difference between each carrier. So be careful about that, because if you're taking a tier 3 preferred brand drug with one company, another company may consider, not all the time, but may consider that tier 3 a tier 4. And in that regard, you're paying hundreds more, could pay more than a few $100s a month just for that one prescription. So be careful about that. So that's one thing I can offer to you. And then the next screen, Sarah. The other thing to be cautious about, not so much cautious about, but just to be aware of is, have you ever been talking with friends or family members about Medicare and they're talking about the donut hole and they don't sound very positive? Well, it's because they're not talking about the dessert. They're talking about being in the donut hole as far as their prescription drug costs are concerned. And the donut hole is not the best of places to be because it increases your prescription drug costs. So let me explain that to you just a little bit, and I'll try not to bore you to sleep because sometimes insurance can be a little dry. But every year, you're going to start off at 0 with your prescription drugs. And when you go to the pharmacy, you'll pay your copays for your prescription drugs. And generally, again, if you stay in tiers 1 and 2, you're not paying a whole lot. Could be a few dollars. However, we're talking about the total retail cost. You'll pay a copay or a percentage, and then the carrier you're with, of course, pays the bulk of whatever that retail cost is. However, we're talking about the total retail cost of all your medications. So in most cases, if you're in generics, you're not even going to have to worry about the donut hole or the coverage gap, as it's called. However, if you take a lot of tier 3 medications, I know some people who go into the coverage gap already by February or March. So let's go into it just a little bit. In the initial coverage phase, which is the beginning of each year, you'll pay the copays. The plan pays the remaining costs until your total retail drug costs reach the amount of $4,130. And if you reach that point, then you go into what's called the coverage gap or the donut hole. And when you're in the donut hole, then your responsibility for your drug costs increases to 25% for brand name and generic drugs. And you'll stay in the coverage gap or donut hole until your total out-of-pocket costs, which you're paying out of your wallet, reaches $6,550. And then once you reach $6,550, you go into catastrophic coverage, which is kind of a misnomer because that's a good thing, because once you've exited the gap, then you'll only pay $3.70 for generic drugs, $9.20 for brand names or brand name medication, or 5% until the end of the calendar year. In my experience, I've not worked with a lot of members who go into the coverage gap. Most of you won't have to be concerned about it. However, you never know when your health can change. And in the event it's time for you to be taking brand name drugs, then it's time for you to consider the costs associated with that. And that might be a good reason for you to give me and Sarah a call as well, so we can go over that plan with you and see if there might not be another plan that's better for you. All right. And the next slide, Sarah. Well, thanks. So let's talk about some of the next steps. We would love to hear from you. If you have any feedback about this webinar, if there's any way that we can make it easier for you to understand or clearer, please let us know. But we'd like to hear from you so that we can give you a better idea of what coverages are available to you so that you have the best coverage uh, uh, for you. These are very individualized decisions, and everyone has different circumstances, you're at different points in your lives with different goals and different healthcare needs. And Sarah and I can help you sort through these things to find a plan that's great for you. So give us a call, would you? I'd love to talk to you this afternoon. And so pick up that phone. You have my information there. I'm over there on the right. And Sarah, do you have anything that you want to add as well?
I just want to say thanks everyone for joining us today. We hope this kind of cleared up some of the, potholes of Medicare, and we look forward to hearing from you.
That's great. Sarah, thanks so much. And thanks everyone for joining us in this webinar. And we hope to talk to you real soon.
Have a great day.
Bye-bye, everybody.